So before starting the presentation, let me introduce myself. I am Dr. Archana VK, MBBS, MD Pediatrics from BMCRI. As we dealt in our previous class regarding the mid-upper arm circumference and its significance, all of you would have come across so many new concepts, and also it enlightens us the mere importance of the anthropometry in pediatrics. So without any delay, let us begin today's class on significance of length and height in pediatrics. First question what they're going to ask when it comes to measurement of length or height in pediatrics is, when do you measure the length and when do you measure the height in pediatric age group? Most of you will be knowing the answer for this. The length usually we will measure when the child's age is less than 2 years. Or, this is very important. Here, are you noticing that I have written centimeters also? Suppose the child is less than 2 years, or even if the child is less than 2 years but his length is coming less than 87 centimeter, then also you have to tell it in terms of length. And when it comes to height, it is more than or equal to 2 years of age and more than or equal to 87 centimeter. So now tell me, if a child is 2.5 years old and when you have measured his length, it is coming around 86 centimeter, then you are going to present it in terms of length. Second question is, how will an ideal child grow? So first of all, we need to know what is the normal length of a newborn. So in a newborn, ideally 50 centimeter as the normal length. So with respect to newborn normal length, from 0 to 3 months, how much will the length increase? It will increase 3.5 centimeter per month. Similarly, from 3 to 6 months, it is 2 centimeter per month. 6 to 9 months, it is 1.5 centimeter per month. And 9 to 12 months, it is 1.3 centimeter per month. Whereas for 2 to 5 years and 5 to 12 years, approximately it comes around 6 centimeters per year. Okay. So this is the ideal way how the child should grow. But what you should remember is, when will the length double? Ideally, it doubles at the age of 3 years. Sometimes even it can go up to 4 years, but doubling of the length is seen by the age of 3 years. Okay. Coming to the next question, can we measure length in more than or equal to 2 years age group? Yes, sometimes you will have to measure length in more than 2 years age group also. Already I have told, when will you measure? If the total length of the child is less than 87 centimeter. Okay, or if the child is developmentally delayed and is not able to walk or stand, then also you can measure length in that child. But what we have to remember is, though we have calculated the length that is in the recumbent position, we have to convert it to the height, because any child who is more than 2 years old, we will be dealing in terms of height, right? How will we convert? For this, we need to understand, ideally length is 0.7 centimeter more than the height, correct? So length is 0.7 centimeter more than the height. So suppose now I have got the length of this more than 2-year-old child as 61.7 centimeter length. Then how will you convert it to the height? Simply by subtracting 0.7 centimeter. Now it will come as 61 centimeter. So what is the height of this child? You're going to tell to the examiner. You'll tell that I measured length because the child was not able to walk due to the developmental delay or some other reasons, or maybe the child is sick. Now I have converted the length to the height, that is around 61 centimeter. Why is it that we have to tell it in terms of height only? Why can't we tell in terms of length? Because once the child crosses more than 2 years, the growth charts which we are using, either it can be WHO growth charts, IAP growth charts, all these growth charts are with respect to the height. They have been documented with respect to this 0.7 centimeter difference. So that is why it is mandatory for you people to convert the length to height, mainly if the child is more than or equal to 2 years age, right? So we got to know why is it needed, because ideally growth charts show difference of 0.7 centimeter between length and height. Now we are going to measure the length also we are going to measure the height. For this, the first thing what you should know, to measure the length in less than 2-year age group, what is the instrument we ideally use? What is the name? It is called infantometer. Infantometer. What is an infant? Infant is the one who is less than 1 year age group. But still, up to 2 years, you can use this infantometer to measure the length of the child. So what are the prerequisites and how many examiners are required for measuring the length? Let me explain you it in a pictorial representation. Are you seeing here how many examiners are there? Ideally, 2 examiners are there to measure the length of the child. One standing near the head end position and other examiner standing near the foot end position. Also, note the hands where they are placing over the child's body. The head and side examiner is placing both the hands to stabilize the child's head in the fixed board. The head end board is fixed board. It will not move. So, you're going to fix the crown of the skull of this child near the fixed end of the infantometer. Now look at the second examiner. Her right hand is being placed over the child's knee so that she can gently press the child's knee and stabilize it over the surface board. The other hand, that is the left hand, is used for sliding the foot end. So what is the moving end here? Moving end is the foot end. Sliding end or moving end of the infantometer is the foot end. Also, try not to include multiple clothing layers in the child. Even the diapers or the braided hairs can alter the length measured. Look at the plane of sight. Plane of sight is perpendicular to the surface board. It is perpendicular to the surface. This is how you are going to measure the length of the child. Now I am showing a infantometer which usually you will be seeing in your pediatric postings. So as I said, what is this? This is the head end. Here you should fix the head of the child, and then this is the sliding end. In end is used to place the foot of the child. Make sure that the soles are touching the scale board. So what are the point of contacts you are seeing here over the surface board? One is the occiput of the skull, correct? Second is her shoulder blades are being touched. Third is her buttocks. Try to touch the calf muscles to the board. And fifth is the sole of the foot. All these are the point of contact over the surface while measuring the length of the child. See here, when you are measuring the length, you always measure to the last completed 0.1 centimeter. Understood? Suppose the child's length when you measured, for example, is crossing between 63.4 centimeter to 63.5 centimeter. That means the foot of the child is between 63.4 and 63.5 centimeter. Then you have to take the reading as 63.4 centimeter as the length of the child. Understood? So it is always the last completed 0.1 centimeter. Some students in the examination hall, due to the stress, can make the mistakes of reading the centimeter board and the inch board. Never forget this. Always try to document it in terms of centimeter. See here, I have given you one more pictorial representation. After we have dealt with the correct measurement of the length, can we make out the mistakes what has been done here? Yes, first of all, the point of contact. Are all the point of contact correct in this child? Occiput, is it lying on the surface board? No. The child head is turned to one side. Shoulder blade is touching the surface board, correct? Hip buttocks are touching the surface board, but calf muscles are not touching and the soles of the foot are not stabilized at the foot end. Child, is he looking perpendicular to the surface board? No, child is looking at me. So it is not a correct plane of sight for the child. Understood? And any examiners are there here? No. No examiners are there in this measuring room. So this was about the length, how do we measure, what is the instrument and the prerequisites and the examiners required. Okay, let us know how to measure the height of a child. For this, what is the instrument which we are going to use? For length we used infantometer, but for the height we are going to use stadiometer. I usually tell to my students how to remember this. Stadiometer is used for the children who can stand steadily. Stadio, stand steadily. So for them we use stadiometer. For which age group ideally? More than equal to 2 years, right? And more than equal to 87 centimeters. So what are the prerequisites and how many examiners are needed in height measurement? Here also we need two examiners, one at the foot end and the other one at the head end. This picture you are noticing that the child is standing over the stadiometer and then the two examiners are stabilizing the child to measure the height. Here the moving end is the head end. There in the length it was foot end, right? So here the sliding end or the moving end is near the head end, whereas the foot end is the fixed end, which was opposite when we were dealing with infantometer, right? So now look at the examiner one who is stabilizing the lower limb of the child. Her one hand, that is the left hand, is stabilizing the knees so that the calves will gently touch the stadiometer, and the other hand, that is the right hand, is stabilizing the ankle of the child so that the soles are in contact with the stadiometer. The examiner too is stabilizing the head of the child by his two fingers, that is the forefinger and the thumb finger, over the mandible and making sure that the child is not moving his or her head while measuring the height. The other hand is sliding the head end and gently compressing the hair of the child so that we will not get false results. Second difference is, look at the line of sight. Here I had told in infantometer that the line of sight should be perpendicular to the surface, right? So this was perpendicular. Here in stadiometer, look at it, the line of sight is parallel. The line of sight is parallel to the surface pole. So this is the second difference. Correct? See, occiput, blades of the shoulder, then buttocks, calf muscle and the sole of the foot all are in contact against the board. Here also measure the height to the last completed 0.1 centimeter. So now we have learned how to measure the height of the child perfectly. Now you tell me, what are the mistakes which we are seeing in this picture? The first one is the child is not looking at the right plane of sight, isn't it? He is looking at me. Ideally it should be what? The plane of sight should be parallel to the surface, which is not seen here, right? The second thing is, yes, his occiput is in contact, his shoulder blade is not in contact, his hips, no, they are not in contact, then calf and foot are also not in touch. This is not the ideal way how you are going to measure the height of the child. Understood? So make sure you rectify these mistakes when you are measuring the height of the child. Now the most difficult part comes after measuring the length and height is to mark it in the growth chart. All of us will do rightly till here and then we forget to depict it in the growth chart, which is very crucial. Why is it important? Because even if we measure height and length correctly, but we are not depicting it in the growth chart, that means we are not predicting it. We don't know what is happening to the growth chart, whether the growth is stunting, whether the growth is flattering, or it is stagnant. We will never know if we don't mark it sequentially. So all of you should make it a habit to mark it in the growth chart as soon as you are going to measure the length or height. Okay, for 0 to 5 year age group ideally we use WHO growth charts, and more than 5 years we prefer using IEP growth charts. This you should remember. Now I have also taken few of the growth charts so that it will be easier for you to depict in your clinical practices. For example, 1-year-old child length is 75 centimeter. What is the length of 1-year-old child? His length is 75 centimeter. At 2 years, his length is around 87 centimeter. Okay, 87 centimeter. That means he is in the median standard deviation of that graph. That means he is fitting in the normal range of that population. So when do we tell there is a problem? This is the Z score charting, or you will have one more chart called as centiles chart. Okay, this is the centiles chart. So when it comes to Z score, when will we tell that the child is below average? Means it should be less than 2 standard deviation below the mean. 2 standard deviations means what? -2 is the first one and -3 is the second one. That means Either it should be less than 2 standard deviations from the mean, or it should be below -3 standard deviation. So for example, at 3 years of age, if the child's height is coming at 75 centimeter, note down here, yes, it fits into the definition of short stature, but we don't know what is the reason for the short stature. So this is the one point about short stature definition. The second thing is, when it comes to percentile, sometimes you will be having percentile growth chart and you will not be having Z score. For that also, what you should remember is, a child's height is coming below third percentile, then he is considered as short stature, right? If it is coming between 15 to 85th, somewhere here, then it is in the good range. If the child is reading more than 97th centile, that means he is having a tall stature. Can be Marfan syndrome or genetic, anything can be possible. Readings what you are going to get for the particular age is with respect to the gender. Understood? So for females the readings will be different, for males the readings will be different. Make sure you're going to mark it accordingly. So pink depicts for the female gender. Again the same things with respect to the centiles you're going to mark. Coming to more than 5-year age group, this is how the IAP charts look like. Okay, see the WHO growth chart, they would have documented it as WHO. IAP also will be documented over the growth charts itself. It is from 5 to 18 years. It has both weight and height. Here it is in terms of centiles. Okay, so same, if it is below what centile, third centile, then you're going to tell it as a short stature. If it is above 97th centile, then you're going to tell that the child is having a tall stature. Pink depicts for the female, and they also have the same range in terms of centile. So try marking it and see if the child's growth is consistent with the normal ideal growth pattern what we had discussed earlier. In the first 3 months it should grow 3.5 centimeter per month. The graph should be like this in the potential growing manner. It should never be this way. That means flattening, stagnancy, there is no growth, or it should never be in terms of good growth in the beginning, then there is stagnancy and there is deterioration, it is coming down. This is also bad. What are these charts? This I had not mentioned. This is a Fenton's chart for the newborn's length measurement, right? In the newborns, whenever you are measuring the length, what was the normal length of a newborn? Around 50 centimeters, what we had told, right? So his normal newborn will be around 37 to 38 weeks of gestation. So for him the length will be ideally around 50 centimeters, which is coming to the 50th centile. That is the normal mean for that age group. Also note down, in the Fenton's chart you can mark as early as 22 weeks also. That means you can know how the child is growing in utero. Whenever they do scans, in that also they will be giving length, weight and all, no, the scans, those also you can document and see from in utero till delivery, is the growth curve being maintained. If the growth curve is not being maintained and it is turning this way, that means there is IUGR, intrauterine growth restriction happening. What is the reason? We don't know. We have to find out, right? It can be like hypertension, diabetes, sepsis, or any factors which is hindering the child's growth in utero has to be rectified so that we get a viable, healthy term baby. Correct? Till what gestation you can measure in Fenton's chart? You can measure up to 50 weeks. So this was the overall presentation on measurement of length or height of the child. I have covered most of the questions which will be asked to you people in this aspect, in terms of undergraduates and in terms of postgraduates also. The references I have taken is from WHO SAM protocol, ARASU-MEDPEDS Clinical Pediatrics and OP Guide textbook of Pediatrics. The last thing, as you're seeing in my slide, the assignment. So what is the assignment for you people for today's class is, tell me what do you understand by Frankfurt plane. Frankfurt or Frankfurt plane and its significance in measurement of height and length. If you have any doubts regarding length or height, significance in pediatrics, then do let me know in the comment section. And at the end, don't forget to like, share, and subscribe to our channel. Let me know which are the most curious and interesting topics you people want me to teach in the next video. Thank you so much, students. We'll meet you all soon.